Hello, we are members of the Ketogenic Diet team at CHOC and are here today to discuss the ketogenic diet with you. Our team at CHOC includes nurse practitioners, dietitians, a pharmacist, and a social worker. My name is Aliza Riba. I'm a nurse practitioner and I'm here today with two of our dietitians. We have Jessica Brown and Sarah Quon. Jessica, can you explain to us what is the ketogenic diet?
The ketogenic diet is a specialized diet that's high in fat and low in carbohydrate. On the ketogenic diet, your body will start to burn fat as fuel, which creates ketones. So on the diet, you're going to be eliminating high carbohydrate foods. Over here, we have some foods like breakfast cereal and crackers, French fries. We have tortillas and bread, cookies. And then you have your starchy vegetables such as beans, corn, and peas. You also have beverages such as milk and juice. So all of these foods would be eliminated when your child's on the ketogenic diet. And instead, we would focus on foods that are high in fat. Actually, upwards of 90% of your calories will be coming from fat compared to a typical diet where maybe around 30% of your calories are coming from fat. So you can see here you have things like avocado, sour cream, and butter. You even have things like oil and coconut oil. And then you have your protein foods, eggs, chicken breast, bacon, and then we want to reserve our carbohydrate for fruits and vegetables. And Sarah, can you tell me what a ketogenic diet ratio is?
So when we talk about a keto ratio, we are referring to the classic keto diet. When we talk about ratios, we are talking about a 1-to-1, a 2-to-1, a 3-to-1, or a 4-to-1. And what this describes is the amount of fat in grams compared to the amount of carbs plus protein. And when we go up on the ratio, we are increasing the amount of fat in the diet and decreasing the amount of carbs. We usually keep the protein the same because we want to make sure they have adequate protein for growth. So, for example, in the pictures here, we showed that on a 1-to-1 ratio, we are equally balanced between the amount of fat compared to the amount of carbs plus protein. Once we go up to the 2-to-1, you could see that the scale tips and that we have more fat and a little bit less carbs. The same goes for a 3-to-1, and finally at the 4-to-1, we have 4 times the amount of fat in comparison to the amount of carbs plus protein. So given this, Jessica, can you show us what a classic keto meal looks like?
Absolutely, Sarah. So today we're going to weigh a 2-to-1 ratio meal using hot dogs and broccoli. Here we have a gram scale, and we provide our families with this scale and teach them how to use it when they start the diet. So let's start off. We're going to start off weighing our broccoli, and we have 60 grams to weigh. So I'm just going to place some of this here, and we just wait until it gets to 60 grams. It's okay if you go over. You can always take a little bit off, and you can always cut pieces a little bit smaller. Oh, looks like I went over. And 60.4, we teach our families you can round down. So there we go. Here's the broccoli for the 2-to-1 ratio. All right, so we have our broccoli measured. Let's go to our next ingredient, which is cheese. I'm gonna put a clean plate here and make sure my scale is zeroed out. All right, we have 18 grams of cheese. Place this on here. Looks like we're at 19, so I'm gonna just take a little bit off. And it looks like I just need a little bit more added back on to get to my 18. Oh, and there we are, 18 grams. All right, so let's measure our hot dog. We have 57 grams of hot dog. Let me get a new plate here. I'm just gonna take a little bit off and let's measure that hot dog. We're at 64. Take a little bit off. And we just need a tiny bit more to get to our 57. Sometimes you go back and forth a little bit here, and that's okay. All right, we are at 57 grams of hot dog. All right, our last ingredient is butter. Let's get that fat in there. This is the ketogenic diet after all. All right. We have 15 grams, which is about a tablespoon. Put this on here. We're at 10 grams, just need a little bit more. And we're at 15 grams. All right, so now we have everything measured, and this is what a 2-to-1 ketogenic meal would look like. And what Sarah and I suggest is that you take the butter and melt that in with the cheese to make a nice cheese sauce that you're able to either dip the hot dog in or put it over the broccoli. So Sarah was talking about the different ratios, and you can see here we have a 1-to-1 ratio where you have more carbohydrate than you did on the 2-to-1 ratio. So we've actually included some grapes in this meal. This is a 3-to-1, and you can see the volume of the food gets smaller as we advance the ratio. These are all providing the same amount of calories, but as we increase the ratio, more of your calories are coming from the butter. So Sarah, we've talked about a ketogenic meal. Can you tell me what a modified Atkins meal looks like?
Yeah, of course. So a modified Atkins diet, before I show you really what the meal looks like, let me give it a little bit of explanation about what it really means. So there are a couple modified versions of the classic ketogenic diet. There is the modified Atkins diet and the modified keto diet. On the modified Atkins diet, we are keeping track of how many carbs they are getting per day. And typically we are giving around 10 to 30 grams of carbs per day. On the modified keto diet, we are also keeping track of how much protein, carbs, and fat they're getting per day. So, if we were building this meal together, we can start with adding 1 hot dog, which would be around 1 gram of carb. Then let's add around 1.5 tablespoons of cheese, which wouldn't have any net carbs. Then let's add some butter, so maybe a couple of tablespoons, and that should be no net carbs there. And finally, maybe about a 1/3 cup of broccoli, so that equates to 2 grams of carbs. So as you can see here, our total net carbs for the meal is 3 grams. So what's perfect about this diet is that there's several different phone apps available to help keep track of the carbs, fat, and protein. So now that we showed you guys what a meal looks like, Jessica, could you show us what formulas are available on the ketogenic diet?
We have multiple formulas that are designed specifically for the ketogenic diet. You can see how many we have here. They come in multiple different flavors like vanilla and chocolate, as well as unflavored. And we also have a whole food blenderized formula available. So if your child drinks formula, you can use these, or if your child is fed through a G-tube, you can also use many of these formulas so that your child can start the ketogenic diet. So Aliza, how do you start the diet?
Sure, Jessica. When a child continues to have seizures after trying 2 different anti-seizure medications, your doctor may consider trying the ketogenic diet as the next line of treatment. At CHOC, the first step in starting the diet is to meet with the ketogenic diet team in our clinic, where we will evaluate if the diet is appropriate for your child and your family. We also require screening labs to be drawn to ensure that the diet is safe for your child. After that, we arrange for the child to be admitted to the hospital for 3 to 5 days, where the diet will be started and gradually adjusted to the goal ratio under close medical supervision. This includes daily labs and education provided directly to the family by our dietitians. The family is sent home with very specific recipes determined by the dietitian and the medical team. We continue to monitor labs after you go home, and the families follow very closely with our dietitians to ensure the patient is tolerating the diet and to adjust any recipes as needed. Sarah, can you talk about how effective is this diet for seizures?
Of course. So even though scientists don't really know exactly how the diet works, we know that it has been established as a very effective treatment for epilepsy. In fact, it's been used since the 1920s. When we talk about effectiveness, we usually talk about it in the rule of thirds. So 1/3 will have a 90% reduction of seizures, with half of them becoming seizure-free. Another third will have a 50% reduction in seizures, and the final third typically do not get enough benefit from the diet to continue. Aliza, would you be able to tell us how long they'll be on the diet for?
Well, Sarah, the answer to that depends on the patient themselves. The diet may become effective in reducing seizures immediately in some patients, or it may take a few months. We ask for our patients to remain on the diet for 2 to 3 months for us to determine whether the diet is effective. If the diet does not demonstrate any significant improvement in seizures after that time, the child will be weaned off the diet over a course of a few days. If, however, the seizures improve on the diet, we typically continue the diet for a period of 2 or 3 years and then gradually wean off the diet over 3 to 6 months. If the seizures reappear during the time of weaning off the diet, we would then resume the diet. For those children who've obtained seizure control while on the diet, 80% of those will remain seizure-free even after coming off the diet. Jessica, can you talk to us about potential side effects of the diet?
Aliza, just like medications, the diet has potential to have side effects. Those side effects include elevated cholesterol, bone health, kidney stone, and constipation. We do monitor everything through routine labs and regular clinic visits. Clinicians have actually been practicing this diet for 100 years. Therefore, potential side effects have been identified and appropriately managed. Aliza, do you have any advice for families who are considering the ketogenic diet for their child?
Yes, Jessica. The diet should be administered only under close medical supervision. During the course of treatment with the diet, your keto team will provide guidance on medication management, specific recipes, what to do if your child becomes sick, and close monitoring of overall growth and development. There are also numerous blogs and websites available that may guide you through your journey on the diet. We strongly recommend the charliefoundation.org. This website provides recipe ideas that you can review with your dietitian and also provides a list of centers across the nation that offer the ketogenic diet. Ask your neurologist if the ketogenic diet may be an option for you. Hi everyone, I'm Aliza, the nurse practitioner who was just in that video along with Jessica and Sarah, our dietitians. We're just here to answer any questions you may have or anything else you want to discuss with regard to the diet.
Does it work? Does the keto diet work on the histone methyl transferase channel?
Sorry, can you repeat that? Does it work on the?
Histone methyl transferase channel, the HMT?
That is a very good scientific question that us as clinicians might not be able to answer. I would say, Laura, that there's multiple different mechanisms proposed that the diet is working. I think it's multifactorial, but I think scientists really haven't completely identified the exact mechanism of how the diet is working. I don't know, Lisa, if you had more to share on that, but as clinicians, we're probably not the best to be able to answer such a scientific question.
I have a mutation on that channel and it's really rare. There's maybe 10 articles written on the exact mutation, but that's the channel it's on for the seizures. And I've been on the diet 12 years.
Wow.
And it does reduce the Quon syndrome type seizure, but it does not touch the grand mals.
So for a specific question like that, I would typically just kind of send you back to your neurologist to ask that specific question. But certainly, we've certainly seen with our patients, it definitely can work on grand mals and the generalized tonic-clonic seizures. And I don't know that that's necessarily sort of diagnosis dependent. But yeah, I would go back to your neurologist to discuss that further in your specific case.
I have met some other people online with this mutation, and some of which are at the University of Michigan. And they only been on the diet, and that seems to have, but they started way younger than when I started. I started in my mid-20s. So could that play a role in how effective the diet is when it's initiated?
So I would say with any treatment for seizures in general, typically the earlier you start it, the more effective it is. So be it medication, be it the diet, or some other form of treatment that just is as a whole for any kind of epilepsy before your brain kind of sets up all these networks. that's not to say that it can't be effective, but generally, the earlier on we start in treatment, the more effective it would be.
Okay, thank you.
Any other questions? Well, that's it. Thanks for joining us.